Subscribe for your daily OT brain warm-up. Henry, who has a unilateral below-elbow amputation, is beginning training in functional kitchen tasks while using a body-powered prosthesis. Henry reports difficulty spreading butter on a slice of bread because the bread keeps sliding around on the plate. Which intervention strategy is most appropriate for the therapist to teach first? B. Use the prosthesis to stabilize the bread against a non-slip surface while the intact hand spreads the butter toward the body. Ace, who has a unilateral below-elbow amputation, is working with the OTR to learn compensatory strategies for greater independence in eating and kitchen tasks. While practicing filling a glass of water from the faucet, Ace reports difficulty stabilizing the cup while reaching to turn the faucet on and off. Which compensatory strategy is most appropriate for the therapist to teach first? A. Use the prosthesis to firmly grasp and stabilize the glass, while the intact limb turns the faucet knob or lever. Context: using the prosthesis to stabilize the glass allows the intact limb to control the faucet with more precision. This promotes effective bimanual task use, increases independence, and reduces compensatory one-handed patterns. Marjorie, who has a unilateral below-elbow amputation, is learning to bake cookies at home and is practicing bimanual kitchen tasks while using her body-powered prosthesis. She reports difficulty carrying a cookie tray because she feels the tray tilts or slips when she tries to lift it. Which strategy should the therapist teach first? C. Hold the tray close to the body using the terminal device for stabilization, while the intact limb supports the opposite side of the tray. Context: holding the tray in mid-position close to the body while using the prosthesis to stabilize the tray and the intact hand to support and guide improves control, balance, and safety. This promotes effective bimanual task performance and prevents one-handed compensatory patterns. Jordan, who has a unilateral below-elbow amputation, is learning to complete kitchen tasks while using a body-powered prosthesis. During a session, Jordan practices peeling fruit, but reports that the fruit rolls around and is difficult to control. Which compensatory strategy is most appropriate for the therapist to teach first? B. Use the prosthesis to stabilize the fruit on a non-slip surface while the intact limb peels the fruit toward the body. Context: using the prosthesis to stabilize the fruit with the terminal device allows the intact limb to peel toward the body with control. This promotes safe, coordinated use of both limbs and reduces compensatory one-handed patterns. Learned something or nailed it? Follow us to stay OT sharp. You got this.